Our next speaker is Dr. Rania Awaad. Is a medical doctor with a specialty in psychiatry. She is currently on the faculty as a clinical instructor in the Psychiatry and Behavioral Sciences Department at Stanford University, where she also heads the Muslim and Mental Health Research Lab and is the clinical director of Al-Khalil Center in California. Dr. Awaad has ijaza to teach several branches of the Sharia sciences and is on the faculty at Zaytuna College. Her research interests include addressing female-related mental health and medical issues from fiqh-oriented perspective. She currently serves as a director of Rahma Foundation, a non-profit organization dedicated to teaching Muslim women and girls traditional Islamic knowledge. Dr. Awaad is a fellow of the International Association of Islamic Psychology. Dr. Awaad, please.
Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Wa sallallahu ala Sayyidina Muhammad wa ala alihi wa sahbihi wa sallam ajma'in. It is my honor and pleasure to be addressing you all today. My special thanks to the International Association of Islamic Psychology, to Dr. Malik Badri, a hero of mine, as is, I'm sure, for many of you as well. And Abdullah Rathman, thank you so much for your invitation here. I'm so happy to be able to share with you a little bit about the work that we have been doing in relation to Islamic psychology in the States. But I will start first with a historical understanding of where we stand and how the past really shapes where we are in the present and into the future, inshallah ta'ala. The first thing that I wanted to share with you for a point of reference is the lab that I direct at Stanford. It's called the Muslim Mental Health Lab and Wellness Program. And this is a research lab that has several lines of research in it, one of which is specifically dedicated to Islamic psychology framework. And in this, I work alongside with the Khalil Center, who will also be presenting today, my colleagues from there. And as well, you might see here another line of research which is particularly important, which is the historical line, that the understanding of where it is and what the understanding is of mental health in our Islamic Golden Age and in the era that's come before where we are right now. That really shapes the discussion for today, and we really have to start here from understanding that we come from a very rich history in relation to Islamic psychology. The contributions that our noble predecessors have actually brought forward absolutely shape everything that we are doing, even though we may not fully be cognizant of it or have actually read it ourselves or researched it. And so many times when you read about history of Muslims in relation to the field we today call psychology, we often find that there is really just a discussion on that Muslims translated works of the Greeks. We talk about Bayt al-Hikmah, right, the House of Wisdom, but often we don't know what exactly was translated and what exactly was then added, even though the Muslim intellectual heritage is quite rich and vast. So part of the work that I personally have been doing, and others in this room as well, is uncovering that work again, inshallah ta'ala. And today I'll share with you a little bit about that. First, we'll discuss the Islamic Golden Age, which there is some discrepancies exactly what centuries, but some people will say as early as the 7th century, some say 8th or 9th. And in terms of where it ends, there's also a discrepancy and discussion there as well, whether it ends somewhere in the 12th or 13th, or perhaps it never actually ended. And I think this is where more research hopefully will emerge from the likes of the people in the room to discern, is this accurate or not, inshallah ta'ala. What many of us as Muslims are very proud of is the advances in medicine, in the sciences, in the humanities, that we often pride ourselves as Muslims related to the Golden Age. However, you don't really hear a lot of discussion related to psychology specifically when people talk about the Islamic Golden Age. And this was really the impetus for my own interest in the topic. Because often growing up, like yourselves, we would hear how proud we are of our golden era, but I often thought to myself, how is it that we had people talking about science and math, astronomy and the likes, but nobody was talking about the mind? It didn't quite add up. And that launched a whole series of research into this topic. And at any given time that you would walk into my office, you would find stacks of books and stacks of books, mashallah, from all these different centuries. And many of them were medical manuscripts, as in to say, if our physicians at the very least talked about all of the diseases of the body, they typically started from the head and went to the toes. And so it wasn't too hard to find the section that related to the mind and their understanding of what would today be called psychology. Alhamdulillah, we had the chance to look at 112 medical manuscripts and take out from them the understanding of our noble predecessors of what they had understood to be the field today we call psychology. Let me share with you a little bit of the findings. Inshallah, you all know many of these. That the golden period there was in fact what we call a positive attitude towards things related to mental health and to psychology. It is proven by the fact that there was actually financial resources put forward from those in power to both research and to write. There was no mass printing press, so any books that are retained were copied by hand over and over and over again until they reached the modern era. And so if a book or science was said to be beneficial, it was going to continue to be written from one person to another in essentially the system we have in Islam, which we call the sanad system. There is always an isnad, an unbroken chain of transmission. Even in knowledge such as this, even in medical knowledge, there would be such a thing. And if nobody wrote the book, continued to write the knowledge, it would not reach the modern era. Again, there was no modern printing press. So the caliphs and those who were in power, if they deemed something to be really well, they would continue to fund the writing and the publication, essentially, of it. You also find proof of this is that the hospital systems flourished, and I will explain in more detail about that, particularly as it relates to psychology. We also see that there's so many other contributions, and take a look at this with me. I want to show you concepts that many of you who are psychologists in the room will recognize, but probably you recognize it as attributed to somebody else in history. Often you will see these concepts, and look at this one that has the dog here. This idea of conditioning. When someone is conditioned, right, the dog or a human is conditioned to give an immediate response over time, who do you typically credit this with? Pavlov's theory. However, what do you see here instead? Ibn Sina. And you take a look at others, like the concept of innate and acquired behaviors that also Imam al-Ghazali spoke about, or that acquired behaviors can be learned gradually, that Al-Kindi spoke about. And so on and so forth, you will see concepts from psychology that you attribute to others that in fact come from your own heritage. Look at this, for example, that you have here the idea of preventing psychological illnesses at the same rate of preventing and working with and treating physiological medical illnesses. This is something Al-Balkhi spoke very commonly of, as well as others like Ibn al-Qayyim. And this idea of storing positive thoughts to draw from on a rainy day, so to say, on a day that is difficult, that you draw from a well of positive thoughts is something Balkhi spoke of as well. However, today we would term this positive psychology, for example, and those who are actually the experts of positive psychology would not know where its origins are. And how do we blame them if we ourselves don't actually have this knowledge, you see? So this line of inquiry, of really understanding where concepts first emerged, requires one to be able to read the original sources in the primary languages in which they were written. Often these are in Arabic, at times they are in Farsi, and likely later languages like the Ottoman languages are also going to be places where you can find these concepts. However, if you don't have literacy in the primary languages, you will never really be able to figure this out for yourselves. You'll only be able to rely on secondary or tertiary sources, which are usually in English or French or German, which may not themselves have had access to the primary sources. Also, this idea of what we think is a very new age term, like mind-body medicine, in fact, is something that our noble predecessor spoke at length. In fact, in Al-Balkhi, Abu Zayd al-Balkhi's book, in his introduction, he specifically says, I am writing this book. The first half of his book is all medical, bodily illnesses, and the second half are all psychological. And he says in his introduction, I am writing this book specifically because physicians of my era continue to write about medical or physiological issues and neglect the psychological issues, and I'm going to bring the two together. And he considers himself a pioneer in this. And I think to myself, subhanAllah, al-Balkhi, if you were here today, you would still be disappointed. Subhanallah. So here we are with so many amazing, really, when you inquire into this more and more, you find that our predecessors really had such foresight. Like for the example that you as psychologists may say, psychological testing, personality testing, well, this is not novel. In fact, you see here that Ibn Sina, Ibn Qayyim both spoke about this, about matching people properly to get the best effect as possible. Also the understanding that there is an innate, kind of the temporal or the temperaments that people are born with, as well as environmental factors that shape them, is something that has also been talked about. And, actually before I go there, and you see that all of this then coalesces into a very important system. Because here, when you look at these sources, you can say to yourself, perhaps this was all theoretical. Perhaps they wrote and thought quite a bit about this. But it turns out that it was more than just theoretical. And proof of this is the Islamic hospital system. Because the hospital system is concrete walls and a roof, an actual institution in which the theory is now being practiced and put into practice. And where in the world does the first psychiatric, what we'd call a psychiatric institution, emerge? Do we know? I am addressing a room full of people interested in Islamic psychology. Where is the first psychiatric hospital in the world? Allahu Akbar, thank you. Baghdad. And in what era? What century? We have one person with the answer. Barakallahu feek. In the 8th century of Baghdad. Why is that important? Because when you think about the 8th century Baghdad in the Muslim world, what is the corresponding era in Europe? The Dark Ages. And how are the mentally ill treated in the Dark Ages to our knowledge? Yes. At worst, they are burned as witches at the stake. And at best, they are sent to monasteries because of the understanding that the mental illness was a spiritual illness only. So they sent them to the people of faith, of religion, of spirituality. So at best, they're sent to a monastery with a very limited understanding of what the issue with mental health is, thinking that it's only a spiritual cause, not too far from where many Muslims are today, unfortunately, in their thinking of mental health. And at worst, they are burned at the stake. But across the way in the Muslim lands, not only do you have scholars who are really thinking strongly and very deeply about these topics, but you see it coalesce into actual programs of care. So the Islamic hospital system is incredibly novel to the world. And in there, you start seeing the first ward, psychiatric ward within a hospital system, first and foremost is how it starts. And then this becomes so strong and popular that they then become standalone psychiatric, what today we would call psychiatric institutions across the Muslim lands, in every location and in every century. This becomes very important because then the Muslims are also developing what today we would call a humanistic treatment of the mentally ill. And this was the trademark of the Muslims, that when they treated illness, they were very humane in their treatment. Perhaps not always, but this was, by and large, the trademark. Second of all, you find something very important developing, what we call the interdisciplinary team, that is taking care of the person who is ill. This would include the person that is like the physician, the tabib, the helper assistant, which today we might call the nurse. You find the person who is doing what the case management, as in to say how a person is going to do after they are discharged out of the hospital, which today we may call the social worker. You find the person who is compounding the medications that today we would call the pharmacist or psychopharmacologist on this team. And lastly, you would also find the spiritual healer, the sheikh figure. And this interdisciplinary team would round to each and every patient that is hospitalized in this hospital system to make sure they are doing well. Now, at Stanford, elite university in the country, in the world, mashallah, they pride themselves on an interdisciplinary way of treating mental illness. And I think to myself, subhanallah, the system has already been developed and has been widely used in the previous generations, but we, subhanallah, are none the wiser to know our own heritage and know where this originated from. Even more interesting and compelling is the payment, the actual fee structure of how this was all paid for. We find that the funding for this is coming from Baytul Mal, from the Awqaf system, and it is actually paid for by the Islamic government, meaning that anyone who has any amount of mental turbulence is able to go get treatment free of charge, even if it is lifelong. Not only that, but you will also see that the zakat money that is collected from the Muslims, that is very specifically earmarked for certain categories, as we know in fiqh, one of those categories can be used for the treatment of the mentally ill. Did you know that? When we say this, alhamdulillah, when I say these things in the US, where people feel that they are very advanced in the treatment of psychiatry and psychology, we get to this point and they all freeze. We do not have a socialized system of medicine in the US, as you know. And so the payment structure of mental illness is actually quite expensive and difficult to access. So we get to this point and then they finally raise their hands and say, you are much more advanced than we ever have. Trying to frame kind of a revival of sorts of knowing what our history was and where to go from here. Furthermore, it's also important to talk about the fact that our scholars did not just see mental illness as only a spiritual problem. They saw it as what we would call a multifactorial problem. They understood that there was the innate and then there was the exogenous. They understood that there was environmental causes as well as physiological causes, and even the concept of it passing down from generations, which today we would call genetics. They may not have understood the chromosomal structures per se, but they understood the passing down of things, subhanAllah, which meant that it wasn't just treated within spiritual quarters or just with a sheikh or imam. This is a very important point because in the modern Muslim world, when we talk about mental illness, often the first line responders are our dear imams and shuyukh, but they may not necessarily be trained in mental health unless they're dually trained, such as some of us are. But the reality is the majority are not dually trained, and because of that, there are limitations to what the spiritual leader can offer. Knowing that beyond the offering of spirituality, there is much more potentially that the person needs than the imam can offer. Furthermore, Okay, and here is actually a discussion of the different hospitals, just examples of some of the hospitals in the different parts of the Muslim world. Of course, here you have Dar al-Shifa and many others, like the Hospital of Sulaiman, Qanuni, and also the Ottomans' endowments, mashallah, that was very widely used here and throughout the Ottoman Empire. But furthermore, there's also what we call the medical treatments that are related to. So here in the modern world, we split psychology away from psychiatry. We split medical issues away from psychological issues. But our scholars really did talk about, again, this concept of the mind and body, that the two are synchronous, and they have to be looked at together. And as somebody who's trained in psychiatry, as a psychiatrist, I find it very often, because I often say to people, I am certainly an oddball psychiatrist, in that although I can prescribe medications, often the majority of the time that I do is spent in therapy. Because I feel that that is an incredibly strong suit in how you treat the person, and if medications are needed, and sometimes they are, we may discuss that. But beyond that, and in addition to that, therapy is much more important. And I feel that this kind of treatment is essentially what our noble predecessors understood as well. Certainly they didn't have SSRIs and such, but they did have herbal concoctments that they did use. And there are books and books written about these prescriptions that they had at the time. And these natural, what they would call natural remedies. And as for psychotherapy, really here understanding that there really was a classification between depression, anxiety, anger, and obsessions. And several of the scholars came up with this concept. Al-Balkhi notably, but also I'd like to point you to Najib ad-Din al-Samarqandi, who probably is the very first time in history that we find a very refined classification of psychological disorders. And not much is actually written about him. We know very little about him, subhanAllah. But his classifications and then his subcategorizations match the current DSM to a level that is uncanny, subhanAllah. And I really think that this is going to be a very interesting person to look into as we go into the future. That brings us to this fellow and some of my own research. This particular fellow named Robert Burton is in the 1600s, and he is credited to be the first person in history to have discussed in a very brief case scenario the very first time in literature the concept of obsessive compulsive disorders emerge, OCD. And as we are taught in our training, I'm sure as you were taught as well, that OCD was considered to be a new disorder that hadn't been discussed previously in history. It bothered me because I felt that we have in a concept of our deen the concept of waswasa. And when we talk about waswas, we often talk about the whisperings of the shaitan, and we speak about people who are, when they are muwaswas, they are somebody who is, we often think about constantly making wudu or constantly repeating their prayers, at least in an Islamic framework. And I thought to myself, how is it that you can have a limitation of something that seemed to have existed age old, but is only a new disorder? Well, subhanAllah, this is where Dr. Badri, it's been so interesting. Before our dear Dr. Badri's book was translated into English, the Arabic was available, and in the time of my training where I had books and books and books stacked in my office, one of the books I came upon was Abu Zayd al-Balkhi's book, Masalih al-Abdan wal-Anfus, and in there he has basically chapters, what seems like chapters, where he's splitting the different psychological disorders. One of the chapters specifically speaks about what he calls wasawis al-sadr, right? Again, that word, waswasa. But then he launches into a very deep discussion that honestly to a modern-day psychiatrist feels like you're reading the DSM. And it was so interesting how many things he brought together in that chapter that I actually went over to my mentor at Stanford and said to him, this was a person who is now retired, but when he was there at the time, he was considered to be one of the forefathers of OCD in America. And Stanford actually has one of the main 5 clinics that ever emerged in OCD in America. So they're very proud over there of their research on OCD. And when I approached this professor, and actually I'm sure his name the humor of this will not be lost on this crowd because his name is spelled Koran. He is not Muslim, but Dr. Quran is a dear person. And he also, so when I approached him with this topic, I said to him, Dr. Quran, I think I found something that's really interesting about OCD that seems to have really, the classification of it seems to be really specific and the treatments. And he said, no. I said, why not? He said, because I am a history buff. I have translated everything there is and read everything there is. I even wrote this paper. He was pulling papers for me to read. And he said, look, I wrote about the Greeks and I wrote about the Romans and I wrote about I don't know who. And I said, but it's in Arabic. That's why you can't understand it. And he said, fine, go ahead and translate this chapter. I did a very brief rendition of this chapter and I presented it to him. And he was jumping. He started to jump up and down. And he said, this must go to publication immediately. And he was just so excited because he could see, as somebody who was well versed in OCD, that this likely was the first in history, Wallahu ta'ala alam, actual explanation, not just a little case vignette, but an actual discussion of the classification of the treatment of what today we call OCD by Abu Zayd al-Balkhi. And in the 9th century, so Robert Burton is in 1600s, but the very first person to finally put it all together in an actual discussion in a medical text is actually in the 1900s. So from the 9th century to the 1900s, that is a millennium, right? A whole millennium of a difference between when they thought OCD was discovered and when it actually, wallahu alam, was. So here, let's talk about Balkhi first before I share with you a little bit more. What do we know about him? We know that he's from a region called Khorasan. We know that he's what we would call an encyclopedic scholar, as many of our scholars were in history. Somebody who was able to join many of the different sciences together. Often when you read the biographies of our noble predecessors, you'll find that their primary education always meant that they had Islamic studies under their belts. Often you would read he was a hafid at the age of 8 or 9 or 10, and he was somebody who completed his work in hadith and in fiqh and sirah, and he did such and such and such, and then he mastered this science and that science and the other science. This was the heritage we came from. It was almost like a given that they were already a hafid of Quran. So today when somebody is a hafid and we make a really big deal out of it, then it was a given. If you were going to become an encyclopedic scholar, you already had the Islamic sciences mastered before you went on to do anything else. Also, an encyclopedic scholar meant that you are somebody who was able to do, you were so well versed in so many different sciences. So even al-Balkhi, although we're so excited to really talk about him today, it turns out that he was more famous for a completely different science, the science of geography. In fact, there is an entire school called the Balkhian School of Geography. I say that because we think, my goodness, he must have talked really much more in mental health and things related to psychology. But the reality is, he was more known for other things, and that speaks to his encyclopedic nature. Here is the book by our dear Dr. Badri and our hero, mashallah. And he really brought to light the English version to have access for all of you, inshallah, in al-Balkhi's work, which he really did a very good job in bringing the lay Arabic into the hands of the modern, of the people around him, to really understand psychology in a non-technical Arabic. When you read the works of Ibn Sina or Razi or some of the other more famous physicians, you'll find that they are writing in a more technical, high-level, or very medicalized Arabic. Sometimes it's very hard to follow, but al-Balkhi's is very easy to read, mashallah, even in the modern day. You also find that he did this really interesting thing where he split aside what we call time-dependent and symptom-dependent. So he understood that there are different factors that come into play in psychological disorders. This is very, very progressive for this time period, subhanAllah. He also talked about barriers to treatment, and if you look at these, you'll find that they're not terribly different than where we are today. He says, for example, that if you think something comes from the devil, like let's say waswas, the whisperings of the devil, his response to this is, so be it. do your adhkar, do your istighfar, speak to the people of religion, but also talk to somebody who today we would call a counselor or a therapist, right? He talks specifically about taking apart these negative thoughts and bouncing them off of somebody who can actually help you discern what's real and what's not. Today we would call this person a therapist. Also, the very last line here, which is an important line, that Allah subhanahu wa ta'ala, we learn from the hadith that Allah subhanahu wa ta'ala, whenever He brings down an illness, He also brings its cure. And this we can say is really an impetus for our scholars in the Islamic understanding of why it is they did all this work they did. Because when they saw something in front of them that seemed pathological, they said, well, for sure Allah subhanahu wa ta'ala will send its cure. Well, cures don't fall out of the sky, wallahu alam. They come in the form of human beings like you and I, who discuss and develop and actually come up with the cures. And this is the science behind what today we would call psychiatry or psychology. Also, Al-Balkhi spoke about this idea of external and internal. So he spoke about this idea of, avoiding things that cause problems, like loneliness, right? And he talked about internal things, like making sure that you remind yourself the unreality of the fears. This is very similar to some of the wording that we find in the DSM. And here, the DSM specifically, the slide that I want to show you is this one right here, where you can, and I want you to really look at these closely if you can. This particular chart is published in the Journal of Affective Disorders. I put for you the reference. We published this in 2015. And it's basically the side-by-side comparison between Al-Balkhi's criteria for OCD and the DSM-5, which was published in 2013, and its criteria for OCD. What are you seeing? Clearly the wording is different because he's writing from the 9th century. But what are you seeing? Unreal thoughts, here you see recurring persisting thoughts. Preoccupation with fearful thoughts, here you hear marked anxiety, trying to resist them, attempts to ignore. Physical symptoms, we understand them today to be compulsions, expecting bad things to happen, the tendency to overestimate, and so on and so on and so on. Meaning that Al-Balkhi was able to discern what today we would have as every criteria for the diagnosis of OCD he was able to reach in the 9th century. Now, when this went to the Journal of Affective Disorders, they were so blown away by this that they did something I've never seen medical journals do, and likely will never happen again, wallahu alam, but they immediately published it. They were so excited about the rewriting of history, essentially. When we tried to write the next article, this time it was on Balkhi and phobias, because he has different concepts that he speaks about. This is the one on obsessions. Inshallah, you can refer to the journal article for this. But for the one on phobias, which we published in the Journal of Anxiety Disorders, I have here just a couple of comments from the reviewers, because I thought they were really poignant. You see, when you read about the history of psychology and the history of medicine, you'll find something really interesting. You'll find that either there is no mention of Muslims in Islamic civilization or heritage at all, or you find that there's sort of like a kind of a cursory mention of Muslims, and usually it says something like they translated the works of the Greeks and Romans, and then they just skipped to Freud. As though nothing happened in between, and as though there weren't any other civilizations, not just the Muslim ones, but also Indian and Chinese medicine, for example, completely skipped over. But when they do mention the Muslims and slight us in that way, it's very bothersome. And one of the particular historians is Barrios. So when the reviewers wrote back, and I quote here, they thought I was a him, so they said his, that's okay. Exposition of Al-Balkhi's work overturns the views of one of our most distinguished historians of psychiatry, Barrios, actually naming him, by showing that phobias had in fact been a focus of medical attention long before the 19th century, at least in the Islamic world. That was not only, it wasn't just a feeling of vindication, mashallah, but it was also an understanding that we are embarking on a very important point in history now, essentially reclaiming the narrative of what was actually our own heritage. And also doing something very important. I'm just going to, for sake of time, just skip a couple of funny things here. but I kind of skip to the point of something really important about this topic, which is that you have people in history, and how do you bridge that gap into modern times? Well, certainly, you're going to have a couple of limitations in doing so. You have the concept of presentism, which means that we are looking with our own glasses, what we know today, and looking into the past and assuming that they fully understood things. Now, in many times, and according to the reviewers that were reading these articles, they agreed that it actually did work. But you have another really important implication here. You have the implication of the fact that there is trans-historical significance of these illnesses. And that makes a very big important difference for those who are studying these sciences. They are looking at something like OCD and saying, wow, the same constellation of symptoms that existed and was understood in the 9th century travels through history and through time and through cultures and languages and still exists in the modern time. So the trans-historical significance, even if people aren't interested in the idea of the Islamic heritage, just pure secularist scientists are still interested in the topic of the trans-historical significance of these findings. So even there, we are able to speak the language that is important to them. If you add in the work of dear scholars like Dr. Badri and the work of Beneflu into the mix, you then find something very important for those who are interested in Islamic psychology. You're able to then understand what the framework is to then build upon in modern times what Islamic psychology ought to look like. So you can't build something without going back into the past. See, our heritage is one of sanad, one of teacher to student and teacher to student and teacher to student with an unbroken chain of transmission. You cannot break the chain. And when we try to rewrite things or just Islamicize things, you are doing what? You are translating, giving Islamic terminology onto concepts that are not yours to begin with, right? Or you are doing what? You are trying to create something completely neglecting all that came before you, which is why the first day of the conference has to be discussion of the past before we can talk about the present and then go into the future. Inshallah, this is our Islamic tradition. In closing here, a couple of last thoughts. When we talk about culturally and religiously advice for practitioners, there's something very important here. So many of us are so excited about these concepts and we want to immediately take it into our clinical practice, those of us who are clinicians. But we have to be very careful in doing this as well. This is a newly emerging science, a revival of it, which means we are just starting to put the framework together, right? Insha'Allah ta'ala. So in the meantime, we do our very best, but to also consult with all the other, this is why this conference is so exciting. There are so many people in the room who have been working on this individually in different corners of the earth, literally, and now are coming together to speak the common language and put the framework together, insha'Allah. Now know that this is not just limited to Muslims. It's important to understand that we get the spirituality from our deen. You have the many parts in the Quran and the Hadith, and I won't belabor this because inshallah you all know this, of how Islam, it really inspires us to do our very best and to always turn and rely on Allah subhanahu wa ta'ala. But in addition, we should know that in general, others have definitely been doing the same, including those from other faith traditions. And when I was going through my own training and trying to develop this and set up my own research laboratory many years ago, there were no Muslims in the States that I could find who were really doing this work at this level. Where I sought mentorship was actually from those who were working on the field of Christian psychology, for example, or Jewish psychology. One of my own mentors here, Dr. Koning, who's at Duke, is someone I went to go train with and flew all the way over there to be able to see how it is in Christian theology they were able to draw from their own faith to put together what today would be called Christian psychology. But to understand that we have so many now studies that are showing that bringing religion into psychology is actually useful. And because it's a faith, it's very common in your faith, very common in your faith for people to draw on their faith to be able to seek assistance, then us too, this is very much the case. So with that, I'll just close with this last slide here, and because there'll be an entire presentation on the Khalil Center for my colleagues, we'll go ahead and wait until that time. But I'm very excited about this project that we have happening in the US, which we are building essentially a living laboratory of taking all that we're learning from the research and putting it into clinical practice with real patients, with real clients. And this has become really very interesting of how to integrate concept of Islamic psychotherapy into professional and modern psychology. So I very much look forward to speaking with all of you more about this, and my colleagues, Dr. Haman and Dr. Fahad, who are both here from the Khalil Center as well. Tomorrow we'll be presenting on this and in the panels. So I hope, inshallah, you'll see how it is that we're taking the research and theoretical into the clinical and actual practice, inshallah ta'ala. We ask for your tawfiq and du'as, and please keep us in your prayers. Thank you very much. Wassalamu alaikum wa rahmatullahi wa barakatuh.